Blaise Dietz, the Medicare Concierge here. I created these videos to help you make informed decisions about the greatest healthcare plan in the country, Medicare. Now, Medicare Part A and B, when combined with the Medicare Supplement Plan, can offer amazing peace of mind because you will never receive a single medical bill if you structure it properly. You can positively know exactly what your total medical expenses will be for the year, regardless of any health issues that may arise. Or I should say, when they arise, because eventually they will. You will receive a lot of information from carriers. You could spend all of your time trying to figure it out on your own, or you can watch my videos here to help you decide on how you want to structure your healthcare options. If you ever want to talk, you can contact me directly and I'll give you unbiased advice and help you sign up for all things Medicare. As an independent agent, I'm able to represent all of the top rated carriers, and the best part is the government won't let you pay me for the advice. You never have to pay a fee to work with me or any independent insurance agent. That's the carrier's job. Let's get on to the education. When you turn 65, most people qualify for Part A of Medicare, which relates to your hospital visits. It's based on your work history in regards to how long you've paid into Medicare. But to qualify, you had to have paid into the system for at least 10 years or 40 quarters in order to receive the Medicare benefits at age 65. People under the age of 65 who qualify for Social Security disability are also eligible. Let's talk about Part B. You will also want to sign up for Part B, which is the portion of Medicare that takes care of your doctors and doctor services. Don't let the table on your screen confuse you. Unless you file an individual return during retirement that has more than $85,000 in individual income or more than $170,000 in combined household income, you will pay the lowest amount out of your Social Security check for Part B. Just look at the red arrow for that number. Once you have Part A and B, you will have 80% of your hospital and doctor's office covered by Medicare, which is great. But what about the other 20% that's not covered? This 20%, which is not covered by Medicare, can end up bankrupting the household and really ruining the golden years. I've seen it happen several times, which is really sad to see because it doesn't have to happen. That's why you really want to understand your Medicare supplement options, also commonly referred to as Medigap, which covers that remaining 20%. By choosing the right Medigap plan, you can eliminate receiving any medical bills and forever have peace of mind knowing exactly what your total annual medical expenses are. So Medicare supplement policies, again, are designed to cover that 20% gap in coverage that, again, Parts A and B do not cover. There are over a dozen medical supplement plans from A through N that cover various different parts of that 20%. These plan types, A through N, are all standardized and regulated by the government. So no matter which insurance carrier you go with, the plan details are identical. This will sink in later as you learn more and more about Medicare supplement plans, but it's really important to remember so that you're not sold on a particular carrier. Let's look at where it states that in the Medicare and You Handbook. Here it is. Okay, let's scroll down here. In the 2017 Medicare and You Handbook, this starts on page 81 and ends at page 83. So this is the important part right here. Different insurance companies may charge different premiums for the exact same policy. As you shop for a policy, be sure you're comparing the same policy. For example, compare Plan A from one company with Plan A from another company. Here's what that means. Let's say you talk to somebody and they talk about Plan A with Aetna, for example. Well, it's exactly the same Plan A with United Healthcare as it is with Mutual of Omaha or Transamerica's Plan A. The big difference, the most important difference that you have to be aware of is the price that the carriers charge. These prices vary by zip code, age, and a few other factors. So the most popular plan in the country, and that's why it started, 55% of seniors are on Plan F. Plan F covers everything. It is the Cadillac of Medicare supplement coverages. And it's the most popular because that is what a lot of agents are trying to sell you on. Now, it's also the most expensive type of Medicare supplement insurance and typically is where most people waste money. I like to ask people a question when we talk about Plan F. And of course, it's in jest. But I like to say, do you know what the F in Plan F actually stands for? Take a guess yourself. It stands for flushing your hard-earned retirement dollars down the drain. Now, I go over the finances of the plans in great detail in the rest of my videos, so I want to keep going on with the education here. There are really just a few plans that make the most sense for the majority of seniors. The reason why most agents sell Plan F is that it pays them the largest commission. But for most people, it's a waste of money and most likely not what you want to have as a Medicare supplement insurance plan. Plan G or Plan N are typically the plans that offer the most value today. Now, it only takes about 15 minutes to determine which plans offer the best value for you in your respective zip code. Because again, remember, these prices are different in every single zip code or region in the country. Here are some important notes to write down. These are extremely important details about how Medicare and really Medicare supplements work. You don't have to worry about networks, PPOs, HMOs, or begging a primary care gatekeeper for a referral to a specialist if you have a Medicare supplement plan. This is an important fact. When you turn 65, when you are first eligible for Medicare, you have what's called guaranteed eligibility to sign up for this supplement plan. This means that no health questions besides are you a smoker or non-smoker. That's why it's critical to choose the right plan when your window of eligibility opens up. Once this window shuts, you will be subject to health underwriting questions. And if you do not qualify for a Medigap plan due to a health issue, you'll be forced into the Medicare Advantage world permanently. Do not miss the sign-up window. When the eligibility window opens up, you can choose whichever insurance carrier has the best rates for you and your zip code. No other questions asked. Here's another key fact to write down. If you or somebody you know already has your Medigap plan, but you've experienced a price increase, or if you're in Plan F or Plan C, which is being discontinued in 2020, you can change your Medigap or Medicare supplement plan anytime you want. You do not need to wait for an open enrollment period. That only relates to Medicare Advantage plans. So if you currently have a Medigap plan and your carrier has increased your rate, or if your original agent put you into Plan F, then you need to take advantage immediately. Because again, Plan F is being discontinued in the year 2020. Now, I monitor my clients' rates for them, and when there's an opportunity to save the money, they're automatically notified. Again, the thing to remember, you can change your plan and save money anytime you want during the year. Here's a quick tip. Make sure the agent you choose to help you is contracted with many, if not all, of the Medicare supplement carriers in your state. You do not want to work with an agent that only represents one carrier. That's the core difference between working with independent insurance agents and what are called captive agents. If you speak to a carrier's call center directly, you'll speak to a new agent most likely every single time you call, and that is a captive agent. They are only allowed to talk about that particular insurance carrier's line of products. Again, these are called captive agents. Finding an independent agent that has access to all of the top carriers should be your main goal. A good independent agent is always going to have your best interests in mind because he or she's not beholden to any one insurance carrier. A few more notes on independent agents. Independent agents can shop all of the companies for you and show you which ones you qualify for, and then secure the best rate on the right plan that makes the most sense for you. Remember this. Only independent agents work for you in an unbiased fashion. So here's another great fact about the cost of Medicare supplement plans. The cost of the supplement plan is exactly the same as it would be if you called the carrier directly. But remember, that captive agent that you'd be speaking with at the carrier isn't allowed to tell you what other carriers are charging for the exact same plan. That's why I love being an unbiased independent agent and why it's so important for you to speak with one. If you enjoy learning from me and would like me to be your personal Medicare concierge, I would be honored to take care of you for the rest of your life. Please call me directly at the number that you see. And if you see a schedule a call button, feel free to click on it and select a time in my calendar that works best for you. God bless.